So this is my investigative report on bulimia and nervosa for CMM 125. What is bulimia nervosa? Bulimia nervosa is a psychiatric condition that affects many adolescent and young people. It is characterized by a binging and purging behavior because of an extensive and extreme concern for body weight. It can also lead to serious medical conditions. Binging or binge eating is a pattern of disordered eating, which consists of rapid uncontrollable eating. After binging comes the purging, which is the act of removing consumed foods from the body by means of either self-induced vomiting, misuse of laxatives and diuretics, or excessive exercise. Bulimia nervosa is also separated into two subtypes, the purging and non-purging. While both types use a purging method, purging generally brings to mind self-induced vomiting or the complete removal of food, so that's why they've titled the two subtypes purging and non-purging. So for the purging subtypes, patients will engage in a method to remove the binge food from their bodies, so they will use self-induced vomiting, they will misuse laxatives, diuretics, and even use enemas. And in the non-purging subtype, patients use periods of fasting and excessive exercise to remove the effects and the calories of the binged food. And I had a friend ask me what the difference between non-purging bulimia and anorexia was. And the difference between the two is that non-purging bulimia still has the periods of like binging and binge eating, while anorexia does not. Anorexia is just fasting and excessive exercise, and the non-purging bulimia has the binging, the exercise, and the fasting. But regardless of the subtype or what type it is, all bulimic patients have negative self-esteem, self-worth, and self-evaluations, and therefore they place an inappropriate and extreme importance on weight and body image. There are many signs, symptoms, and also medical conditions that come from this disorder. So bulimia nervosa affects both the mind and body, leaving both physical and psychological signs that indicate whether someone has bulimia nervosa. Some psychological signs include fixation on the number of consumed calories, extreme fixation on weight, low self-esteem, depression, anxiety, panic disorders, drug and alcohol abuse, and constant bathroom trips. And many of the physical indicators or symptoms include chronic acid reflux after eating, Russell sign, which is calluses or scars and scabs on the backs of the hands or on the knuckles from repeated trauma due to the incisors and the teeth, enlarged glands and puffy cheeks from swollen salivary glands from the stomach acid burning the glands from repeated vomiting, irregular menstrual cycles, discolored teeth, and perimyelitis, which is the erosion of tooth enamel, frequent weight fluctuations, tetany, which is muscle seizures, epileptic seizures, and also muscle weakness. The cycles of rapid and uncontrollable eating followed by self-induced vomiting or other form of purging, repeated several times a week or daily, may directly cause some of the following medical complications: dehydration and hypokalemia, which is low potassium in the blood caused by frequent vomiting, Mallory-Weiss tears, which is bleeding from the tears in the mucous membranes in the stomach, oral trauma, peptic ulcers, Boerhaave syndrome, which is a rupture in the esophageal wall due to vomiting, electrolyte imbalance, which can lead to cardiac arrhythmia, cardiac arrest, and even death. Some of the facts and statistics about bulimia is that there isn't much information on bulimia. It's the main one because it's a very secretive and quiet kind of disorder, because many people view it as being very disgusting and just not something people like to talk about. So eating disorders as a whole affect 5 to 10 million people, primarily young women between the ages of 14 and 40 years old in the United States. While the prevalence of anorexia nervosa for women in the United States is only 0.5% to 1%, the prevalence of bulimia nervosa is 2 to 3% and can reach as high as 10% in more vulnerable populations, such as like college-aged women. In 1979, bulimia was classified as an omnibus variant of anorexia nervosa by Gerard Russell. Gerard Russell is also the guy who discovered the Russell sign. But however, as more research was produced, the two eating disorders are now considered separate. And while bulimia is more prevalent, it is more difficult to identify in a primary care setting because many people have an average to almost slightly overweight body weight, so it's very hard for them to, it's not as noticeable as anorexia. So the disorder is less known and has less information, and it's also less treated in a lot of primary care settings. And while it is more common than anorexia, the small amount of research has shown that with early intervention, the mortality rate is lower and the recovery rate is a lot higher. Mortality from bulimia is approximately 3.9%, and approximately 50% of patients are free from all bulimic symptoms 5 years after finishing treatment. So looking ahead, there's a lot of increased awareness about not just bulimia but eating disorders as a whole, and there's a website called NEDA, which is the National Eating Disorder Association, and they have posts on very popular websites such as Tumblr. If eating disorder related topics are searched, you get a page that says, "Is everything okay?" with a email address, or not email address, a website link, and a title saying that if you or someone you know is suffering from an eating disorder, here's a website that they can go and have help. And there's a picture in the PowerPoint, and in the photo there's also 7 Cups of Tea, which is a 24/7 online chat, which is a helpline for stress, eating disorders, depression, anxiety, mental illness, trauma, and all other things related to that, and it's on the same post as that. So that's all I have for that. Yeah.